hello, and welcome to Trucker Talk Thursday. I am your host, Marsha Withers, and here in Tulsa, Oklahoma, where it is beautiful outside. Yes, we're getting ready to turn into the fall season, and it is just gorgeous. The leaves are dropping, the autumn colors. Well, you all, it is that time of the year. Yes. So we have a whole lot of things going on today. I would like to make a few announcements before we really get started. Go ahead and share this broadcast with your friends, with your family. We are talking about prostate cancer awareness this month, and I would like for you to share this video on your page, share this video with men, friends, family. It is so important that we bring out the awareness of prostate cancer, especially to our trucking community. The reason why this is so important is because you are a higher rate because of the aggressiveness of the vibration as you're driving down the highway. All right. Now, a few more announcements that I would like to make. Last week, I said that I was going to have a dedication for my father for Alzheimer's awareness. Well, it's not next month. Next month is Breast Cancer Awareness Month for all of our female truck drivers who have gone through breast cancer and you're still in the seat. We want to talk to you as well. And we want to acknowledge the awareness of breast cancer and get you some more information about it. You know, as women, mothers, nurturers, we are ones to say, go to the doctors. We're first to go to the doctor for everything. You know, something dropped in my eye, I'm going to the doctor, right? I stubbed my toe, I'm going to the doctor. I fell, I'm going to the doctor. We are so famous for going to the doctor to get our pre-examinations done. And since COVID has taken place, there's a lot of us that's really not going to the doctors because of some of the rulings behind the COVID vaccination. If you had the vaccination, if you had not had the vaccination. Anyhow, we want to make sure that you all are getting your proper screenings, male, female, in preventing the spread of cancer. Okay, now share this video. I have a video that I would like for us to watch today. This video is about 6 minutes long, and it is an advertisement. Well, it's from one of the news stations that is talking about prostate cancer, and they're doing an interview with the president of zerocancer.org. And we're going to post this information later on our page. I want you to really take this into consideration as you're sharing it. If a male figure pops up that you know about, we want to make sure that they get this information, sharing it with your trucker community, sharing it with your bosses, sharing it with various people to make sure that we have the proper awareness that we need to spread the word. It's, 1 to 8 men are diagnosed every year with prostate cancer, and we can shorten this if we have the knowledge ahead of time. All right, you guys, stay tuned and watch this video.
Well, September is Prostate Cancer Awareness Month. So today we're talking about one of the most important and common cancers among American men. It's estimated that this year, more than 268,000 men will find themselves facing a prostate cancer diagnosis.
Despite being responsible for tens of thousands of deaths each year, the prognosis can be a good one if it's caught early. I spoke with Zero's president and CEO, Jamie Beersey, along with prostate cancer survivor Tony Minter, about their message for other men.
As we work to spread awareness, what are we seeing right now with current trends with the disease?
Absolutely. Great question, especially coming out of the pandemic for the last couple of years. But first, let me start overall that there are 3 million American men who are living with prostate cancer right now. And a man dies from the disease every 18 minutes. But there is hope through early detection, and early detection saves lives, meaning that the 5-year survival rate is 99% when prostate cancer is caught early. However, that falls to just over 30% or 31% when prostate cancer is caught in the late stages. And you mentioned the trend coming out of the pandemic. There have been studies that have shown that 77% of cancer patients experience delays or disruptions of some kind during the pandemic. And others have shown a substantial decline in cancer screening rates during the pandemic. So, if you've skipped out on some of your health screenings, prostate cancer testing being one of them, September, which is Prostate Cancer Awareness Month, is a great time to make that resolution to get back into staying on top of your health screenings and get tested for prostate cancer.
Yeah, so important. As you mentioned, one of those things that's not necessarily unique to prostate cancer, but certainly noteworthy is that importance of early detection and how big of a game changer that can be for someone's prognosis. Are you worried that we're going to be seeing more cases now of more advanced cancers because people have put off those screenings for a few years?
That is a concern, yeah, and because I don't know, just as a guy, and I know it doesn't go for every man, but for myself, and I've been involved in this cause for 20 years and talked to a lot of men who are either at risk or a lot of men who are patients. It comes down to any excuse is a good excuse not to go see the doctor for us guys. So if you throw a pandemic in our way, if you say that, oh, you don't have any symptoms, right? You don't need to get tested for prostate cancer, you'll be fine. When in fact, it's a really simple test, and prostate cancer doesn't have any symptoms in its early stage. You can feel completely fine. It's not until you get to advanced prostate cancer where you start experiencing some of those symptoms. So it's important to get in front of that.
Well, Tony, I want to ask you about your experience as a cancer survivor. Tell us a little bit about when you were first diagnosed and your experience with prostate cancer.
Sure. I was diagnosed in 2012. I had been going through screening since age 40. I was 52 when I was finally diagnosed. And one of the things that the doctor said, she says, I got good news and bad news. The bad news is you have cancer. The good news is we may have caught it early. When I was in the military, I was a flight medic. So I was in the medical field, and I understood a lot about health. And so I knew that early detection was important. So when she said you caught it early, I knew that my chances of survival were very, very good. She also told me to take some time and do some research to discover what it was that I wanted to do about my prostate cancer diagnosis. At that time, there was a limit on what you could do about it. It was either radiation or surgery. And so I decided that I wanted to do something that would take care of the prostate cancer and not be so concerned about the side effects. My prostate journey started in 2012 and it still continues this day because of side effects and things like that. But the cancer itself is at bay, and that's due to early detection.
What would you say to someone out there who has not been to a screening yet, maybe is at that age where they got to start looking at it or should have been to a screening or two? What's your advice for guys out there to take that first step?
So my advice is, first of all, to try to educate them. But the advice that I would give them is that prostate cancer is treatable when you catch it early. It's treatable. The journey gets much, much more difficult the longer it goes undetected. You start to feel signs and symptoms. That's not a good thing, because the treatments become more difficult, become more challenging, and the side effects become much, much more serious. So if you know what the risk factors are, and you fall into those categories, African American male, veteran, family history, lifestyles, and things like that, go and get checked out. Don't wait until you have pain. Don't wait till you have difficulty urinating. This is something that can be taken care of if you catch it early.
Okay, so where do you start if you want to learn more about risk factors? Tony mentioned several of them, those screening guidelines, and what to do if you are diagnosed with cancer. There's a lot of resources at zerocancer.org. It really is one of those conversations for the women out there have those conversations with the men in your life.
All right.
For the men out there, those screenings really do save lives.
I hope you all took some of the information that was given in that video, wrote it down. I do truly apologize for the internet connection right now. It's so interesting. When I'm starting doing these videos, the internet gets kind of the bandwidth shrinks or whatnot, and the buffing, there's a lot of buffing going on. However, with the information that was displayed on today or shared with you all today, take the time to really go out and get these screening done. As they stated, one of the concerns is with the pandemic, a lot of people not going to the doctor's office. Go get to the doctor's office. Schedule that time to get your examinations. One of the things that we really have to take in consideration is that if you have a history of men in your family that have suffered from prostate cancer, they want you to go in as early as 40 years old, when you turn 40, to have these examinations. Some people a little bit earlier than that. Just depends on the nature of your family, the health dynamics that you go through. Screening is always going to be important. For this gentleman, he started his screening at 40 years old. It wasn't until he was 52 that he found out that he had cancer. One of the good things about this is that he had 12 years of visiting, 12 years of going to his doctor, getting these examinations. And with these examinations, it built a history and a rapport to know when something new stepped in, another element stepped in your body, right? Now, for us who do not go to the doctor that frequently, it is important now than ever because our whole lifestyle is changing. The food that we eat is changing. We used to have food with seeds in it. We don't have food with seeds in it anymore, fruits and vegetables. And nobody really asks where's the seeds at and how you growing something without a seed. So there's some dynamics that are changing that also affects our body. And as a commercial truck driver, you're out on the road, you're eating, and you may not have a low calorie diet. You may not have a low, a low fried food diet, right? Maybe you're just consuming what you can to get through the day. I'm not sure if you're exercising, if you're walking around, what you're doing, but only you know these things. We're coming to you bringing this awareness so that it can prepare you for your future, as well as if you go to the doctor and the doctor says, look, I have some good news, I have some bad news, or this is where we are, you know how to prepare yourself. Zero to the company's Zero Cancer, they have a lot of information that's on their website for the African American male. They have a column specifically for you all, and I'm going to share that with you here so you can see what that looks like and how that really truly affects your ability to communicate with other people that are going through similar situations. A lot of times we find out that we have cancer or we have some type of illness that we think we can't get rid of, and we go into a depressive state. Well, this information is not to depress you, but it's to bring awareness of a solution for you to have as you see your doctor. When you have to go to your what is it, urocologist for a urine analysis to determine where you are. You have information at your hands. You have it on your cell phones. You have it on your tablets. You have it. And this particular organization, zerocancer.org, has a particular page on their website for African American men with prostate cancer so that you are connected with other people. They have a Zoom call, right? They have a podcast. You're not alone. Even to, our Caucasian male, our, white men, Hispanic man, look, you all have this information here available to you. You don't have to listen to the words of the past, right? Technology has changed. Information has changed. Research has changed. And I'm bringing this to your attention so you can get what you need to make a successful decision pertaining your life and that which will affect your family's life. In one of the videos that I was watching, a gentleman said that, if he would have caught this a little bit earlier, yes, he's still here with his family, but he would have had more I guess you could say more ability to do certain things versus waiting to the last minute and then the cancer has, you had a stage 4, stage 5 cancer and you have maybe not that long to live, or the cancer is so aggressive that it's going to take much, much more money to deal with this situation, and the medical bills for something that is caught sooner than later, that's a big difference in cost. Yes, you do have insurance, but then think about those things that the insurance company will not cover. Are you financially stable to take care of those things as well? That's something that we also have to take into consideration. is the financial cost, the financial cost to your family, the financial cost to your job. Because guess what? When this happens and you have not had the proper checks and balances, you have more time off work than you do if you caught it earlier, in the early stages. As one of the gentlemen said, if you feel the pain when you urinate or you see blood in your urine, that's a little bit too late, because now it's really aggressive. Because a lot of times you walk around and there's no symptoms for you to go to the doctor, so you think there's nothing really happening. Indeed, it is something that is possibly forming, but you can't tell it because you don't have the symptoms. Keep that in mind. 1 out of 8 men are diagnosed with having prostate cancer. Think about this. Go to a truck stop and see how many men are in the break room. If you have more than 8 men in the break room, one of you is going to be diagnosed with cancer. Think about it. If you're in a casino, 1 out of every 8 men is going to be diagnosed with cancer. If you're in your church, 1 out of 8 men is going to be diagnosed with prostate cancer. If you're on the golf field playing golf with your fellow friends, 1 out of 8 men will be diagnosed with cancer. If you're at a family reunion, 1 out of 8 men will be diagnosed with cancer. Think about it. Those numbers are really small numbers. It's not 1 in 50. It's not 1 in 100. It's 1 in 8. Right now, there's over 3 million men that has prostate cancer. Some of them, we don't even know how many men that have it but have not been checked out. That number could be doubled. Awareness is always going to be a key. A solution is a strategy for success. And we're here to provide that for you. We're here to bring you the awareness, a solution, and resources. If you are not sure, scrolling at the bottom of the page is the information to contact Zero Cancer. Even in your area, I looked up in the city of Tulsa, there are resources that are available for men here in Tulsa. Also, too, the American Cancer Association is great with resources regarding cancer. And there's various cancers that's out here. Various cancers. The information is at your hands. And it's up to you to make the phone call. It's up to you to dial the 7 digits to talk to your doctor, to schedule an appointment, and to physically go into your appointment. Not to have an appointment over the phone, but to physically go in and get checked out. Well, I thank you all for watching this broadcast. We are coming up to the end of our last quarter here, and this is the third quarter of the year. Your IFTAs are due next month. If you need any assistance with getting your IFTAs completed, you can certainly give us a call at 800-404-2554, extension 703. And we will be able to help you out with your quarterly IFTA taxes. And next month, we will cover Breast Cancer Awareness Month as well. And we do appreciate you. This was a month as well for Truckers Appreciation, Drivers Appreciation Month. And you had a week of appreciation. I hope you felt the love. I hope you felt the compassion of everything that you do on a day-to-day basis. And please share this broadcast. You know, we're bringing out this awareness, and we need to get the information out. And we ask that you certainly share. If you have a subject matter that you would like us to do the research on and bring it to Trucker Talk Thursday, please send me an email at admin at xlsolutions.biz. Thank you so much for joining. We really do appreciate you all. Have a successful day and share. Thank you so much for joining us. We look forward to hearing you and seeing you next week. And I'm still, if you know any a woman, a truck driver who has breast cancer or who had breast cancer and is not afraid to share her story or her testimony, please certainly have her get in contact with me. I would love to have her on the show to bring more awareness into what's going on in the trucker community and how we are doing as working together, collaborating together to make an end. Now, we know that cancer is not going to end because it's some things that are genetics in some people, but it is something too that is in us for the most part. It's just how it's going to come out or if it's going to come out. It's something that just may be laying dormant and never really evolve around anything because you're taking care of your body, you're eating healthy, you're doing the right things that your body needs to survive in this world. All right, you all, I really do appreciate you. I am signing off. This is your girl, Marcia Withers with Extraordinary Logistics Solutions, providing a solution for you, right, on this Thursday. So thank you for joining us. I look forward to working with you and talking to you all in the next month, or actually next week. All right, see you all later and have a successful day. Bye.